In May, President Donald Trump announced
Operation Warp Speed,
a federal program aiming to deliver 300 million doses of a safe, effective vaccine for COVID-19 by January 2021. Deputy Director Dr. Julie Ledgerwood gave some insight as to whom they're targeting in the vaccine trials.
As these trials are seeking to enroll volunteers from diverse populations, including minority populations at higher risk of COVID,
a population that, according to John Jacobo with the Latino Task Force, is apprehensive about a vaccine.
So there is some sort of concern I'm hearing from you of those essential workers, minorities, feeling like the guinea pigs.
That's right. That's right. And we heard that when we came in the first time to do our testing with UCSF back in April. We absolutely heard people say, we don't want to get tested, and then we're going to be the ones that we're going to be the guinea pigs for potential vaccines to test them out. And we assured them that that's not the case. It's up to individuals to make the choice that seems right and feels right for them.
Latinos, Blacks, and Native Americans have been disproportionately affected by this virus, making race also a main deciding factor when choosing subjects.
Everybody has really been very clear that they want this racial ethnic distribution to be taken into strong consideration. So we're hoping that that will happen.
For now, hope is what's keeping the world's top experts working around the clock. Hope to find a vaccine and hope for an equitable distribution. Meanwhile, the World Health Organization announced it will have a finalized allocation plan by the end of this month, with or without a vaccine. In San Francisco, Luz Peña, ABC 7 News.
You deserve to get this vaccine first. And from there, you want to do tiering in various countries to make sure your most vulnerable populations get it. In our country, that would be Blacks and Native Americans, people with underlying health conditions, and the elderly. And so we need to look at as a globe, and we're involved with many European leaders and African leaders and others in Southeast Asia to make sure there's a purchasing fund that can pull that vaccine through when it's available and get it out in wide-scale distribution.
What would you say when people ask you, how are the first 100 million doses going to be distributed?
Well, I would tell them that the discussion on how to do that started out with ethics and equity. Now, you and I have been on committees before, scientific committees, and we oftentimes start with the science. And then when we have come to some conclusions on the science, then we address the ethics and the equity. This group started with ethics and equity and developed a framework. And then they asked the question, with individuals, what is their risk of getting the virus? What's their risk if they do get the virus of being sick, hospitalized, dying? What's their risk of transmitting this? And what are the things that could change this, like the ability to use a mask and so forth? And from that, then came up with the criteria of who should go first. I think one of the big surprises people expected, since this is a disease that is hurting minorities more than others, people thought we would come out with minorities as the first group to get the vaccine, or the elderly. With minorities, we do not say that. We instead say the problem is not race, the problem is racism. And that if you look at the problems, individual problems, the individual risks of people who are in minorities, they're like the majorities also. And there's a whole list of them, but there are three of them that are really at the top of the list. That's heart failure, kidney failure, and a body mass index over 40. So what if you aim at those things? And then you look at what are the social vulnerabilities, not just the personal vulnerabilities, but the social vulnerabilities. What does it mean to live in a crowded house, 3 generations in a house, inability to work from home, every day having to take a risk of facing the virus, having problems with transportation, school children coming in and out? And so we said, let's look at the risk factors and make those the decision point for getting vaccine rather than saying race.
So essentially, these devils, instead of saying race, they're gonna classify you as low income, not able to do certain things. So they're just trying to use semantics to change the name up.
Recommendations coordinating with the CDC and other agencies. They indicate that the first group of people that should get the vaccine, if and when it is available, are people at the greatest risk. And that includes everything from nursing homes to people with serious pre-existing conditions that would cause people to be in real trouble. A lot of those people happen to be black and brown. And so it would be based upon the degree of exposure. It would go first, though, I would argue, but I have a scientific board laid out for me. It would go first, as laid out for me today, to first responders, doctors, and nurses. The people who we're most needed to have available to deal with our crises, health as well as physical crises in our communities.
Black in America, you're twice as likely to die of COVID-19. Yet researchers are seeing a disproportionately low number of Black volunteers for vaccine clinical trials that could save lives. Ron Allen takes a look at what's happening.
Today marks a major milestone in the nation's fight against COVID-19.
In Savannah, Georgia, Dawn Baker not only anchors the news, she made huge headlines herself last month. She was the first volunteer as part of a phase 3 clinical trial in the U.S. to get injected with a potential COVID-19 vaccine, the final step before a drug can be approved.
You've had 2 doses.
Yes, yesterday, Monday was my second dose.
How are you feeling?
I feel great. I had the
No side effects.
My arm was sore, similar to when you get a flu shot.
Her private doctor for 30 years, who's involved in the study of a drug produced by Moderna, asked her to do it.
Had to make sure that it wasn't a live virus and that there was no way that I could get COVID-19 from being a part of the study.
After seeing so much suffering due to COVID, especially in the African-American community, Baker stepped up.
I've had friends who've lost very close relatives, people that I know. I've also had some friends who have passed as well from COVID-19. So it kind of made sense to me that, instead of just being afraid, how was I going to be a part of the solution?
She's got
plan that intentionally burdens communities of color to hinder access to the vaccine deprives those communities of equal protection under the law.
The governor promises legal action with help from the NAACP and Urban League if the plan isn't changed. He says New York State will mobilize an army of faith and community-based groups to help vaccinate people. David lives in Manhattan.
I appreciate living in a state that actually takes care of things and takes care of their people.
At a time when families are looking forward to Monday, going to school, and not having to switch to a lesson.
The truth is, COVID killed Black people in this country at twice the rate of white people. The truth is, COVID killed Hispanic people at 1.5 times the rate of white people. Those are ugly facts. The COVID infection rate was 2.5 times higher among Black and Hispanic people. And the hospitalization rate for Black and Hispanic patients was over 3 times higher compared to white patients. Those are ugly facts. COVID low tide showed that the existing health disparities in this country made it more likely that Blacks would die from the virus. Black populations are 1.7 times more likely to have diabetes, 1.4 times more likely to have hypertension, 1.3 times more likely to face obesity, and 3 times more likely to have asthma. Those are the ugly facts. So now the vaccine is on the way. Great news. But the big question now is, who gets the vaccine? How is it going to be distributed, and will it be equitable, and will it be fair? The Trump administration is designing the distribution plan. And their plan basically has private healthcare companies administer the vaccine, hospitals, big drugstores, doctors' offices, etc. It sounds fine, right? But hold on. We know that our Black, brown, and poorer communities have fewer healthcare institutions. Their communities are too often healthcare deserts. That's why we have more underlying conditions, and that's why the COVID death toll is so high for Black and brown communities. We're not going to make the same mistake again, period. Majority Black zip codes are 67% more likely to face a shortage of primary care doctors. President talks about CVS and Walgreens and national chains. Sure, but they are mainly located in rich communities, not in poor communities. My friends, we can't compound the racial injustice that COVID already created. Brown communities that were first on the list of who died cannot be last on the list of who receives the vaccine, period. We cannot and we will not let that happen. The Reverend Dr. King, who's
being a Black man in America isn't easy. The hunt is on. And you're the prey.